The circulatory system is the body's most critical highway, transporting oxygen and nutrients to every cell while removing waste products. However, we rarely pay close attention to it until subtle symptoms begin to emerge. If you frequently experience unexplained numbness or tingling in your limbs, cold extremities even in warm weather, or swollen feet after a day's work, these are not just signs of common fatigue. These are urgent signals indicating that your internal transport network is facing serious blockages. Poor blood circulation is not only uncomfortable, but also a warning bell for underlying health conditions, such as diabetes, high blood pressure, or peripheral artery disease, PAD. Recognizing these signs early and accurately is the key to preventing dangerous complications, including ulcers, gangrene, and permanent nerve damage. Poor circulation occurs when blood flow slows down or is obstructed, causing tissues and organs far from the heart, typically the extremities, to not receive enough oxygen and nutrients. This condition is not a standalone disease but a symptom of several foundational health issues, including peripheral artery disease, PAD, which happens when plaque, atherosclerosis, builds up, narrowing the blood vessels. Diabetes, which damages blood vessel walls due to high blood sugar. Blood clots, which can completely block blood flow. And overweight/obesity, which increases pressure on the heart and veins. Monitoring the following signs can help you detect circulation issues early. The most common and noticeable sign is numbness and tingling, a pins and needles sensation, especially in the fingers, toes, and lower limbs. When the blood fails to deliver sufficient oxygen to the nerve endings, they respond with this uncomfortable sensation. This is often accompanied by cold extremities. Poor circulation makes it difficult for warm blood to travel to the areas furthest from the heart, causing hands and feet to feel consistently cold to the touch, even in moderate environments. This temperature discrepancy indicates the body is prioritizing warmth for its central organs. Another clear physical indicator is swelling of the lower limbs, edema. This fluid retention occurs because the venous system struggles to efficiently return blood to the heart. Swelling often appears in the ankles and feet, particularly after prolonged standing or sitting. If a light press on the swollen area leaves an indentation that lingers for a few seconds, it is a clear sign of circulation-related edema. Muscle cramping and pain, especially leg pain during movement, is a classic symptom of PAD known as claudication. During activity, muscles demand more oxygen. If arteries are narrowed, insufficient blood flow causes pain and cramping. This pain typically subsides with rest, but recurs upon resuming activity. Skin color is a direct gauge of the amount of oxygenated blood circulating. When blood flow is reduced, the skin may appear abnormally pale or cyanotic, bluish, due to the lack of oxygen-carrying hemoglobin. Furthermore, blood carries the nutrients and immune cells necessary for tissue repair. So another severe warning sign is slow wound healing. A small cut or ulcer on the foot may take far longer than normal to heal, and in severe cases, runs the risk of developing into venous or arterial ulcers, leading to infection and necrosis. Less vital tissues like the skin, hair, and nails are among the first to experience reduced nutrient supply when the circulatory system is struggling. Therefore, hair loss and brittle nails, particularly on the lower legs, are also signs of nutrient deficiency due to poor circulation. Poor circulation affects the gut as well as the limbs. Reduced blood flow to the digestive tract can cause digestive issues, including constipation or erratic diarrhea. Moreover, impaired blood flow to the brain can lead to cognitive decline and memory issues. If you frequently experience mental fatigue, difficulty concentrating, or brain fog, it may signal insufficient oxygen supply to brain cells. Finally, when the heart has to work harder to pump blood through narrowed or blocked vessels, the entire body can fall into a state of persistent fatigue that does not improve with rest, indicating systemic inefficiency. Detecting these signs is the first step, but timely action is crucial. If poor circulation is suspected, you must consult a doctor to identify the underlying cause: diabetes, hypertension, cholesterol. In the meantime, you can adopt the following measures to improve blood flow. Regular exercise, 30 minutes of walking or swimming, strengthens the heart's pumping ability. Stretching and yoga help dilate blood vessels, reducing venous pressure and improving peripheral circulation. Dietary changes involve reducing salt to lessen edema and increasing omega-3 fatty acids and nitrate-rich foods. Beets, greens, to naturally widen blood vessels. Crucially, quit smoking, as it is the leading cause of atherosclerosis and vascular constriction. For edema, wearing compression stockings is an effective aid to help venous blood return to the heart. The signs of poor blood circulation should never be overlooked. They are clear warnings from the body about the declining health of its most vital transport system. Be proactive in listening to your body. Recognize symptoms like numbness, cold extremities, or swelling early, and implement the necessary lifestyle changes. Circulatory health is the foundation for a life of vitality and freedom from chronic illness.